Sue. I'm 47 years old, and before I came to Magnolia Medical, I had a lot of problems with just being tired, exhausted. When I was 33 years old, I really started having a lot of weight gain. I had gained, by the time I was 34, I had gained over 100 pounds. Went to doctors, I went to personal trainers. I was told over and over and over again that everything was normal. For all of these years, every blood test I had, I would go and I would explain all my symptoms. I'm tired, I hurt, all my joints ached. I felt like I was in a fog a lot of the times. I just felt very, I used to say my brain cells are not working anymore because I just never felt like I could reason through things, especially in the mornings. The mornings were extremely tough. Getting up out of bed, I was very stiff, I was exhausted. I could sleep for hours, I could sleep for days. Going out and doing something with my kids would cause me to be exhausted for 3 days. And I would tell all this to the doctors and they would say, "You're normal. There's nothing wrong. It's diet and exercise. It's diet and exercise." So I spent a lot of time and money on weight loss programs, personal trainers. I even did medical weight loss programs where you'd go in and they would give you the phentermine and you would get the injections, and nothing made me feel better. And I remember asking doctors, I don't understand, who is this normal for? Normal for who? Because it doesn't seem to be normal for me. And I felt like I aged a lot in just a couple of years. From like 33 to 35, I felt like I was 60. And nobody would do anything. Everybody just kept saying it was me. It was my diet and exercise problem. But no one ever gave any real specifics about, what I was supposed to do other than eat less and exercise more and everything will be better. But yet that never worked. No matter what I did, that never worked. When I came into Magnolia Medical, I initially met with Dr. Morris, and he sat, and I told him the whole story of where I've been for the last few years, and he said that he felt like he could help me. And that was the first time a doctor has ever told me that. I remember, I went to a female doctor one time thinking maybe it was a female thing, and she handed me a Zumba pamphlet. And I threw it in the garbage and I walked out and I never went back. So he was the first doctor who acknowledged that there was something that could be going on, that there was a way to fix this, that he could give me some answers. So I was really encouraged by that thought, and I met with the nurse practitioner, and it all started very immediately on my first appointment. Everything started going. They gave me everything that I was going to need to do, and so it was encouraging at that moment that I felt like there was some hope. Well, it's been 4.5 months, so I'm on week 20, and everything is different. Everything is different. I'm down over 20 pounds, which to me that's just a bonus, because the real difference is just in how I feel. All of the fog lift has gone. It's completely gone. It's not there at all anymore. The aches and pains are completely gone. I was having joint and knee pains that if I had sat in a chair for a significant amount of time, like maybe watching a movie, going to a movie theater with the family or whatever, when I got up I was really stiff and it was hard for me at first to get moving, and that's all completely gone. I sleep at night, I get up in the morning refreshed. If I have a late night out with my kids for an activity or whatever, I get up at a normal time the next morning. I don't have to sleep till noon. It just has completely changed my life. I feel 20 years younger in 4.5 months. I was extremely skeptical when I first came in because I felt like this might just be another one of those medical weight loss programs, that it might be just another doctor who's going to talk to me about diet and exercise, and there was some. There was a lot of conversation about diet, and so it really made me very skeptical that I was just going to go through another cycle of what I had been doing for the last 15 years. But the difference to me was that he told me what was wrong. He showed me, this is what's wrong. I know what's wrong with you, and we have a plan to fix it. And I thought, well, that's the one difference from every other doctor that I have ever been to, that he was able to show me, guess what, your blood work's not normal. And here's why it's not normal. And this is what we can do to fix it. And it wasn't easy. It was not an easy transition. This is not something that's going to it's not a magic pill. It's not a magic cure. You're going to have to look at what he's telling you and make the decision to do it. For me, 15 years of feeling terrible was enough. And I did exactly what I was told to do. And 4.5 months later, I feel fantastic. I feel like a whole new person. I feel younger, I feel refreshed, and it's just a matter of following what they told you to do. It was 100% worth my time and money. This was one of the best investments I made because it was for myself. It was an investment in myself. It was to make me feel better. And I was the one that had to do it. Dr. Morris just gave me the knowledge I needed to go forward and do it, and it was worth every penny I spent. It was worth all the time I spent. I do not live in Murfreesboro. I travel here for all my appointments, and it's 100% worth all of it.
Hello, my name is Dr. David Morris with Magnolia Medical Center. I'm glad you're taking the time to watch this video. I know it will answer a lot of questions for those who are suffering with thyroid disorders and metabolic issues. I want you to know that I created this video some time ago, and like this short intro here, there are some other edits to the end of the video that are important. I've changed to look a bit younger in the main body of this presentation than I do in this intro, but the science and our approach to treating your thyroid disorders has not changed. Something that we are very proud of is that our approach to handling complex metabolic issues like thyroid disorders has been so successful that we've had to expand our facilities and our team in order to help patients. So while it is me doing this presentation, our team and our team approach is the reason for our success in helping people get their lives back. As I mentioned again in the video shortly, please watch this all the way to the end. I know it is a little long, but all of the information is important to you solving these issues. Hi folks, my name is Dr. David Morris. If you're watching this, either yourself or someone you know, a loved one, is suffering from a thyroid condition, or you may think you're suffering from a thyroid condition. In my clinic, we specialize in treating chronic illnesses, of which thyroid disorders are among the most common that we see. It is estimated that almost 25 million Americans suffer from underactive thyroid. And we're going to be talking a bit about overactive thyroid, but most people suffer from underactive thyroid, and half of those people are not even diagnosed. You're going to understand a lot more clearly why that is today. If you think you're suffering, or you've been told that everything looks good on your lab testing, you're going to have a clear understanding of why that is happening. So, we're going to get started here today. I want you to understand that we're going to be going over a lot of different material here today. At the very end of this video, I'm going to be giving you the secret to what you can do to actually take care of this problem if you have it, or if you suspect that you have it. So, just a little bit about me. I'm a chiropractic physician in my clinic. I've been practicing for 18 years. Now, I'm not going to talk to you about chiropractic and how to adjust your thyroid, but I do have a postdoctoral certification in mastering the thyroid and a postdoctoral certification in fundamentals of functional blood chemistry. I'm a certified gluten specialist, and I'm currently enrolled in Functional Medicine University, so I'll be getting my diplomate in clinical nutrition. I work side by side with our medical director and our nurse practitioner to help people with chronic illnesses by using functional medicine and functional neurology. So we're a medical clinic here with medical providers as well. By the end of this video, you're going to understand how your thyroid condition really affects your nervous system and your brain even. But we use these two disciplines in treating chronic disorders, and you're going to have a clear understanding of what that's all about after you watch this video. Now, all chronic health conditions have some chronic threads. And before I even get into that, into what this condition entails, I want you to understand that our healthcare system, the way it exists in this country, is very, very good. All right? So we have a healthcare system that's very, very good. Traditional medicine is very good at acute problems. And it's good at keeping you alive. If, like if you have an infection, or you have a broken bone, or you're involved in a car accident, I tell my patients all the time, If you are going to get in a car accident or have a heart attack or a stroke, God forbid, make sure to do it in the United States, because our healthcare system is very good at that, the best in the world. Every statistic shows that acute care we're phenomenal at. But where our healthcare system and where traditional medicine really falls short is in handling chronic conditions. Now, some of you watching know that already because you've been through many doctors, or maybe you've been going to see your endocrinologist, or you've been going to your internist, and they just cannot pinpoint why you're tired all the time or why you're suffering from underactive thyroid, basically why you feel so awful. They can't tell you, and you're frustrated. And this is because the way they address chronic conditions. And the way we do that is very poor in this country. You have to understand that our healthcare system is very pharmaceutically driven. Now, if you don't believe me, shut this off, turn on the TV, and I guarantee you're going to see some commercial on television for some kind of different medication, prescription medication, that you have to take for a chronic problem. So our system is very pharmaceutically driven. And therefore, for a medical doctor, that is the answer to your chronic condition. Well, that really isn't the way we should go about this. So I often ask my patients, I ask them, probably most of my patients have heard this, name 2 things you can do that would make you healthier. So right now, go ahead, you can do it at home. Think of 2 things you could do to improve your health. Got them? Folks, whenever I ask that question, the answer is never take more medication. You can't medicate yourself out of a chronic condition. You need to understand that. Most of you know this, but some of you don't. You need to get to the root causes. You're going to understand after watching this video that there are multiple pieces to the thyroid dilemma. And your endocrinologist or your primary care doctor is only addressing one, at best 2 of those. So continue watching, watch this all the way to the end, and see what those other pieces are, and that is what we do in our clinic. We get people's lives back. Okay, so all chronic health conditions have some common threads. And you're watching this because you have or you suspect you have a thyroid condition, but I guarantee you have other things going on. Most of my thyroid patients have neurological problems even, like they're getting depressed, or they're forgetting things, or they have to sleep all day, or they're gaining weight. They have metabolic conditions. They have anemias, or maybe they have insulin resistance or unstable blood sugar. Now we know the thyroid has a great impact on gut function, so maybe they're constipated, or they have irritable bowel syndrome, or they have an autoimmune disorder known as Crohn's disease. So here's our chronic conditions, and here's the metabolic and neurological imbalances. So there are a bunch of different things that can happen, but all chronic conditions play off of each other. And all chronic health conditions entail some metabolic imbalances and neurological consequences, or neurological causes as well, which we're going to talk about. And they all affect the brain. So it's a common issue. And if you're going to get your thyroid condition under control, it is a combination of treating both the metabolic problem and the underlying neurological consequences of the metabolic problem. And I'm going to clear that up for you. So let's talk about metabolism. Now, I want to tell you a little bit about myself here. This is just something about me that I want you to know. The way I like to explain things is really down to earth and really straightforward. I grew up on back roads in Slidell, Louisiana, and I want to explain things in ways that most people can understand. So metabolism is a classic example. I could go off into some really long explanation about what metabolism is, but let's keep it real simple here, right? Metabolism means that you eat food and it should get turned into energy. Food to energy, food to energy. That's what metabolism means. Now there's a lot of steps from here to here, and your thyroid function is one of them. And it's a very major player in your ability to convert your food to energy inside the cells of your body. Now we're going to talk about that. Now, one of the things I want you to understand is that 30% of our energy goes to our nervous system. And very few people will guess that. Now, if I took my brain and all my nerves out of my body and put them on a scale, they would only weigh 2 to 3% of my entire body weight. Yet it gobbles up 30% of our energy, okay? So our brain and our nervous system are energy hogs. They're like car engines that get 2 blocks to the gallon. So when we have an underlying metabolic problem like a thyroid condition, this is going to affect your brain. I have patients all the time and they're like, Dr. Morris, I have brain fog. Huge symptom for thyroid. I've got memory loss. I just don't want to do anything. I'm not social anymore. I don't want to be around people. I've got to sleep all the time. I'm depressed. And their body's a prison to them. And it's because you need to understand how much thyroid hormone efficiency affects your brain. It's simply because your brain needs a lot of energy. Now, we all know the symptoms of an underactive thyroid. So you're tired all the time, you're gaining weight, even with low-calorie diets. You have headaches, you're depressed, your hair is falling out, you're constipated, you're losing the lateral part of your eyebrows, you have muscle cramps all the time, you get cold all the time, you get sick real easily, you can't get enough sleep, maybe allergies bother you more than they used to, your skin's itchy, you're dry, your hair is dry, your nails are brittle. On and on. It's not a very good way to live, and it bothers me that there's so many people out there that are really not addressing the underlying issues, and that's why I'm making this video, folks. So your thyroid supports bone metabolism, and so osteoporosis is a very common condition with underactive thyroid. Your immune system is affected, that's why you get sick all the time with colds or flus. Your brain's affected. Now, we already talked about that. So it affects other hormones as well, and your other hormones affect your thyroid, and we're going to talk more about that. So your gut is greatly affected. Your liver and gallbladder function, all of your sex hormones. So low libido, that's a classic symptom of underactive thyroid. You can't burn fat without your thyroid working. So look, here's my simplistic definition of what your thyroid hormone does. So I want you to picture a school building on a cold January morning. It's 4 o'clock in the morning, this building's cold, it's dark and it's windy outside, and you're watching this building from your kitchen window, and all of a sudden you see this old pickup truck pull up, and it's the janitor. And he gets out of the truck, it's sub-zero weather, like I said, the wind's blowing out there, he's going to go up to the building, he gets his keys out, he's freezing cold and shivering, he unlocks the door, he turns the lights on, turns the furnace on, and prepares the building for that day's activities. Folks, that's what your thyroid hormone does in every single cell in your body. Folks, in our body we have trillions of cells, 10 to 20 trillion cells, okay? That's a lot. And every day it's estimated that 50 to 70 billion of those are dying, and hopefully we're creating 50 to 70 billion new ones that are healthy. It's your thyroid hormone that orchestrates the renewal of those new cells. It literally goes into the cell and prepares it for that day's activities. And if that cell's about to die, it makes sure that the DNA in that cell is replicated and there's new proteins and enzymes and structural proteins so the new cells can thrive. This is why where you have high turnover of cells, like in your hair or your nails or your skin or in your gut, these areas are greatly affected with people who have underactive thyroid. Every single cell in your body has thyroid receptors, so this affects every cell in your body. Now there's crosstalk between the different systems in the body. Folks, when we go to school, doctors go to school, we learn about the body. One semester we learn about hormones. Next semester we learn about digestion. Next semester we learn about the heart, and so on. We tend to compartmentalize these systems of the body, but that's not how it works. Everything flows and everything works together. And when one system, especially your thyroid hormone, is off, it can affect everything. It's kind of like how I explained to my kids that are at home. I said, we all know that if mom's not happy, the whole house isn't happy, right? So you got to keep mom happy. Well, mom in your body is the thyroid gland, or at least thyroid hormones. Some of you don't even have a thyroid gland anymore, so it has to be functioning properly. You have to have proper thyroid hormone expression. Now, this is a complicated slide, and I want you to understand a few things from the slide. Number one is there are multiple areas where your thyroid can go wrong. Your doctor's only looking at one of them. You need to understand that, okay? He's only looking at one. Folks, again, our healthcare system is designed for acute problems. It is designed for keeping you alive, and it's pharmaceutically driven. You have a chronic condition. Most of you know that medicine is not going to get you better. Now, does that mean you don't need your Synthroid or your levothyroxine or your Cytomel? No, it doesn't mean that. Some of you probably do. In some cases, some of you don't, but you probably do, and many of our patients continue taking theirs. But you're still sick if that's all you're taking, especially if you have other problems related to thyroid hormone expression. So there are other things going on that are causing your thyroid to not function. Now, I want to get into the physiology just a little bit. I'll try not to bore you too much with this, but it all starts in your brain. Okay? TSH, thyroid-stimulating hormone, is a hormone that comes from your brain. It doesn't come from your thyroid gland. Your pituitary gland in your brain looks at your thyroid, and it looks at the amount of T4 and T3 that you make. T4 means there's 4 atoms of iodine, just to clear this up. T3 means there's 3 atoms of iodine. Those two types of hormones are very different. T4 is mostly inactive, which means it doesn't do anything. And most of what comes out of your thyroid gland is T4. It's inactive. Very small amount, 3 to 7%, is the active form of the hormone, T3. Now your brain, your pituitary gland, has an eyeball in it, as an example, and it's sort of like an air traffic controller for all of your hormones. So the pituitary gland looks at T4, the inactive form of the hormone. When T4 starts to go down, the pituitary gland is going to spit out more TSH so that the thyroid gland will make more T4. That's what your doctor's looking at, or your endocrine doctor. He or she is looking at the brain endocrine gland connection, the pituitary to thyroid connection. So it's an important aspect of your care, don't get me wrong, but it's not the only thing. And that's the reason why most people with underactive thyroid still suffer even though they're on hormone replacement. I know you know what I'm talking about, those of you who are on hormone replacement. The brain and the pituitary gland look at T4. Now, just a little aside, in order for your brain, the hypothalamus and the pituitary gland to work properly when it comes to thyroid function, it needs proper levels of 2 very important neurotransmitters. And those are serotonin and dopamine. If serotonin and dopamine are not in proper amounts, this mechanism between your brain and your thyroid gland will not work properly. And guess where serotonin and dopamine are made? Folks, they're made primarily in your gut, in your intestines. So you can see just off that one system affects the other. So the pituitary gland looks at T4. When T4 drops, TSH comes out. So there's an inverse relationship. When T4 is low, TSH is high. All right? And it goes up to try to kickstart the thyroid gland into making more T4. Now, hormones just don't float around freely in the bloodstream. They have to be attached to something, so they jump onto a protein. Those proteins are usually called globulins. So what's going to happen is T4 and some T3 are going to jump onto a globulin, or a taxicab, as I like to call it, thyroid binding globulin. And that's the taxicab. The taxicab takes T4 over to the liver, the gut, and some other tissues like the kidney. And this is very important because T4 has to get converted over into the active form of the hormone T3 in these areas of the body. So that conversion of T4 to T3 is where a lot of you are having your problems. And guess what, folks? Your doctor's not even looking at that. In fact, if you're on Synthroid or levothyroxine or most thyroid hormones, they don't have any T3 in them. They're T4, and your doctor's assuming that this conversion is taking place. Now, there are different things that will prevent the conversion of inactive T4 to active T3, such as high estrogens for you ladies, and even some men. Now, you have to understand that most women, when they have a hormone imbalance, it's because they're estrogen dominant. Their body's not producing enough progesterone to counteract estrogen. Another thing that will prevent T4 from converting to T3 are high levels of adrenal hormones, known as cortisol. And we're going to talk a little bit about that later. Now, this conversion has to take place. And then what happens is the T3 is made, as it's made, it jumps out of the taxicab like the janitor getting out of the truck, puts the key into the cell, unlocks the cell, and goes in and prepares that cell for the day's activities. That's what active thyroid hormone does. Most doctors don't even address that there could be a problem with the liver or the gut, the kidneys, or other tissues. So conversion isn't even on their radar. So now I know I went through a lot, but you need to understand there are multiple areas where it can go wrong, and every one of these areas needs to be looked at. Now right now, you're going to be thinking one of two things probably, because I've heard it so many times. One is, oh my God, doc, this is great. Now I at least know that there's possibly some answers to why I feel like I do. Or you could be a little bit upset at your doctor because he doesn't investigate this. So let's go over that. I'm going to get into the whole situation with our healthcare system. Folks, our healthcare system, like I said, is pharmaceutically driven, and our insurance companies like Cigna or Blue Cross or United Healthcare or whoever you have, they're also tied into those pharmaceutical companies. And the pharmaceutical companies are, for the most part, calling the shots. All right, there's an old saying that goes, "He who pays the piper is apt to call the tune." So pharmaceutical companies have done a wonderful job at entrenching themselves into our healthcare system. However, pharmaceuticals aren't always the way to go when it comes to treating these conditions. So a lot of times people come to me and they're on an insurance plan and they wonder why their doctor is not doing all the testing or not following up properly or explaining things to them. Folks, I want you to understand, so there's economics into the situation as well, and you need to understand the economics in the situation. For instance, we accept insurance. We work with Blue Cross Blue Shield and Cigna and the other companies. Now, I get reimbursed less for a visit now in the year 2015 than I did in 1997 when I started practicing. I get less now, but you better believe that my overhead is greater now than it was back in 1997. So what does that mean economically? If we were only doing an insurance-only practice, that would mean that I would need to see a lot more patients now than I did back in 1997 to produce the same amount of income, much less cover the overhead. So do you ever feel that way when you go to your doctor? They don't explain anything to you? Well, they don't have time. They go bankrupt. Okay, so they're following an insurance-based model. So here's something I'm going to tell you. Don't kill the messenger. It is the straight up truth about your health, okay? If you want quality health care for a chronic condition, you're going to have to think outside of your insurance plan, and you're going to have to dig into your pockets and pay for it. Folks, and why shouldn't you? What is more important than your health? You know, your health insurance doesn't pay for your car, it doesn't pay for your home, it doesn't pay for your clothes, it doesn't pay for your trips. Does it pay for your cell phone? Does it pay for your meals out? Of course it doesn't. And you know that. Yet you pay for those things because you feel like they're important to you. So why wouldn't you pay for quality health care out of your own pocket, regardless of what your insurance card says you can do? And this is so true, especially with thyroid conditions. I see a lot of chronic cases in my practice, but thyroid patients that come to me and they say, "Dr. Morris, I've been going to this endocrinologist for 15 years. And I feel worse now than 15 years ago when I started." My question is, so why are you still going to him? And they're like, "Well, you know, my insurance covers it, you know." And I'm like, "Well, would you go to a restaurant every night of the week for 15 years and eat food that made you sick? But hey, it was free. Or would you rather pay for a quality meal?" Folks, don't skimp on your health. And I'm just telling you the upfront truth. If you want quality health care for a chronic condition, you're going to have to pay for it. Now, my patients are happy to pay me, and I go over the cost of my care for the care that we deliver at the end of this video. And my patients pay me good money to see me and get better, which is the most important part. And every one of them, if you watch some of our testimonials, say that it's the best money they ever spent because they got their lives back. So you need to understand how the system works. And that's why I'm sharing this with you. All right. So, anyhow, there are many areas, I got off on a tangent there, sorry, there are many areas where the thyroid can go wrong. So, the brain sends signals to the thyroid to make hormone, now we've already went over that, and then T4, which is the inactive form of the hormone, has to become active, and so that's Synthroid is what you're taking. It's mostly T4 and or levothyroxine. It needs to get converted into T3 in the liver and in the gut and the kidneys and other tissues. And other things can go wrong in other areas. So not to go back over that, but now I'm told this all the time. "Dr. Morris, my doctors say my labs are normal. My thyroid is normal, yet I'm still tired all the time. I'm gaining weight. I'm depressed." Let me tell you something, folks. Lab ranges are inaccurate. Lab ranges are inaccurate. Please remember that. This is how lab determines a range on which your doctor is basing the assessment of your care. They take the average high and the average low of whomever's been in that lab for that test over the last year. Now I ask you folks, what kind of people are more likely to go to the lab? Sick people or healthy people? Mostly sick. And is America getting sicker or are they getting healthier? Sicker. So lab ranges are based primarily on sick people, and that is what your doctor's using. Now, we don't use those lab ranges. The endocrine societies determine ranges that healthy people, truly healthy people, will fall into. So from a functional medicine point of view, I have to look at functional lab ranges, not compare you to the average sick American. So if you end up here or here, your doctor is going to say you're fine, but you could have all kinds of symptoms of underactive thyroid, or whatever the condition may be. It doesn't have to be a thyroid problem. So here's an example. We're going to use TSH here in the middle, and this thyroid doctors that most doctors use, and that 0.3 to 5.7. So if you're 4.2, your doctor's going to say you're fine. But we know you're going to have all kinds of symptoms of underactive thyroid because you're not fine at 1.8 to 3.0 as a functional range. You're fine when it comes to an average American that is being assessed, but you can have all kinds of symptoms. So we use functional ranges. So that answers the question, why do I feel so bad when my doctor tells me my labs are normal? All right, so many people ask that question, and that's the answer. Now, for a true functional thyroid test, we run 9 markers on the first thyroid test, not just TSH or T4. We want to know all the different areas where your thyroid is going wrong. Typically, medically, they're going to run TSH and T4, maybe T4. And that is one piece of the puzzle, but there are other pieces of the puzzle, as you now understand. This is a 50-year-old model, folks, that you understand. Just looking at T3 and TSH and T4, it's overly simplistic, but there's more to the picture. Now, the #1 cause of hypothyroidism in this country, many of you have it, some of you know you have it, but many of you probably do not know, is a disease called Hashimoto thyroiditis, which is an underactive thyroid, or you might have Graves' disease, which is overactive thyroid. These are autoimmune conditions. This is where your immune system, your white blood cells, are attacking part of your thyroid, and it is rendering it dysfunctional. In Hashimoto's, you're going to have low thyroid, but I will say this, often in the beginning phases of Hashimoto's, you'll have hyper signs. And if your doctor catches you during a hyper sign, you can get a completely wrong diagnosis. Hyper is where you're jittery all the time, your heart rate's going up, you're sweaty, you can't sleep. And then after a while, the thyroid declines. Graves' disease is always hyperthyroid. We do see cases of Graves' disease, but Hashimoto's is by far the most common cause of underactive thyroid. Now, the reason why your doctor doesn't check for it is because it doesn't matter. Their treatment is going to stay the same. Synthetic thyroid hormone. They're going to look at TSH, and they're going to adjust your thyroid medication based on that marker. From a functional medicine point of view, we're very interested in whether you are autoimmune or not, because it means your immune system is making a mistake. And we're going to address why would your immune system do that, and we will talk about why your body would be doing that in just a little bit. But autoimmune thyroid means that you don't really have a direct thyroid problem, or it didn't start out as a direct thyroid problem. It means you have an immune system problem. So to explain that, just an analogy, it would be like if I'm the thyroid gland, and the immune system comes into the picture here and starts beating me over the head. Well, who would be at fault? The immune system. I'm not at fault, it's the immune system, but I'm the one who couldn't function. I couldn't give my talk here because the immune system is misbehaving. And that's what's happening in an autoimmune thyroid condition, or any autoimmune condition. Your immune system is attacking in the thyroid either the enzyme in the gland, or those Taxicabs, or the proteins that carry the hormone around your system. If it's an immune system problem, then there are imbalances in your immune system, and we need to determine what that is by proper testing. Now, I don't want to get too much into how the immune system works, because I could keep you here for 5 or 6 hours, but understand that in order for anything to get into your body, it's got to make it through barrier systems. So like our skin is a barrier system. If I cut my skin, I've got a hole in my barrier now, so a hole in my defenses. Now, we also have a barrier system lining our lungs, our sinuses, our eyes, our tear glands. These are all barrier systems, our mucous membranes. In our gut, we have a barrier system. And we have a barrier system between our blood and our brain. And all those things are extremely important for your immune system. But once things get beyond that barrier system, then you have the rest of your immune system, which will determine whether or not you should have that object in your body, that antigen or that thing in your body. So in our immune system, we have different types of white blood cells. And again, I don't want to get too crazily involved in this, but we've got one set of white blood cells known as Th1, and these cells that will attack germs. And then we have Th2, and these guys, they're the white blood cells, they're lymphocytes, and they'll form antibodies so that if we're ever attacked by the same invader again, then they're going to get rid of it in a more sophisticated and less violent manner. Now you have these systems, Th1 and Th2, and they have to communicate with each other to stay balanced and in order. We want to know if Th1 should attack something, or if Th2 should just create antibodies. We need to know these things, but there needs to be a balance. So there's a whole other group of cells called Th3 cells, which regulate that system, the Th1 and Th2. So they're called Th3 T regulatory cells, which make sure that your immune system is balanced. Now, why am I spending so much time on this immune system stuff? Well, it's because I guarantee that the majority of you watching this, if you have hypothyroidism, there's a 90% chance that if your thyroid's underactive, that it's autoimmune. That's according to the Endocrine Society. There's a 90% chance that if you have low thyroid, it's autoimmune in nature. So your immune system is attacking your thyroid and you don't know it. And is the reason why you're not getting better despite your thyroid hormone, the synthetic thyroid hormone. So these Th3 cells control the immune response. In autoimmunity, one side is overzealous and it's working too hard. And the other side isn't working hard enough. Now, why would your immune system do this? Why would it make a mistake? So there are certain triggers that would make your immune system go haywire. And by the way, if your immune system is attacking an enzyme in your thyroid, or the protein, or the taxicab that carries around your thyroid hormone, you better believe it's going to start attacking other tissue in your body and become other autoimmune conditions. The bully on the schoolyard isn't going to take just one kid's lunch money. Sooner or later, he's going to take other kids' lunch money. I had one patient that I treated, and she had multiple sclerosis, where her immune system was attacking the covering of her nerves. So she was getting all kinds of neurological symptoms. And she also had an autoimmune thyroid condition. So her body was attacking not just her thyroid, but the nerves in her body. She also was having an autoimmune condition related to her gut, so she was getting Crohn's disease. Now, she didn't know all this, and many times by the time you discover you have an autoimmune disease, the reaction has been going on for so long, for years prior. So we're able to manage your case and manage the autoimmune problem through things that we're going to learn about here. Now, again, what would make what would trigger your immune system? Folks, chronic inflammation is one of them. The standard American diet is extremely inflammatory. One of the reasons why is that we have an imbalance between essential fatty acids. We have omega-3s, which decrease inflammation. We have omega-6s, which we eat too much of, which can increase inflammation. Like they're in everything, like corn oil and safflower seed oil, trans fats, hydrogenated oils. These cause inflammation. So we should have a 1-to-1 ratio on those fats, but in the standard American diet, it's more like 20-to-1. And we wonder why we're so inflamed all the time. So that would trigger an autoimmune condition. So would unstable blood sugar. If you're a diabetic, or you're on your way to becoming a diabetic, or if you have blood sugar that dips too low. I have a female patient right now, she's under care, and if your blood sugar drops too low, if her blood sugar drops too low, she gets PMS symptoms, she gets migraine headaches, and that's actually triggering her immune system to attack her thyroid, the low blood sugar. And she never knew she was autoimmune, so we've been addressing that. Hormone imbalances, neurological imbalances, pregnancy. Many female patients I've seen, they come in and they're like, Dr. Morris, I was doing great. I didn't have any health problems until my third child, and then my health just turned south and it went really bad. There can be an abrupt shift in your immune system right after pregnancy. Low vitamin D, the most common vitamin deficiency in our country. We just learned how to measure vitamin D in the blood in 1997. The Vitamin D Council estimates that there's 70% of Americans are deficient in vitamin D, and that can mess up your immune system. If the acidity of your blood is off, it's too great, that can trigger an autoimmune response. Certain germs or antigens, like chronic infections in the gut, many people have gut infections and they don't even know about, that can trigger an autoimmune response, like parasites or yeast overgrowth or H. pylori, or bacterial infections in the gut that trigger this autoimmune response. Food sensitivities, that's a huge one. Folks, a lot of the food we eat nowadays is different than the food we ate 30 to 40 years ago. They've been genetically modified, which is another whole story that we're not going to have time to talk about, but we're eating these foods now, and a lot of our grains and vegetables and fruits and the DNA is different than what we ate 30 to 40 years ago, and our immune system isn't recognizing it. So ask yourself, do you think there are more things in our environment today that don't belong in our bodies than there were 30 to 40 years ago? That answer is obvious. It's a resounding yes. A lot of it is our food and certain chemicals that exist. So our immune system in 2015 is really working a lot harder than it was 30 to 40 years ago. When a system has to work harder, it is more apt to make mistakes. And one of the main ways our immune system makes a mistake is that it can no longer recognize the difference between what is foreign and what is you, your own body. And it starts attacking self, and that is known as an autoimmune disease. Folks, it's estimated that 1 in 3 women in this country have autoimmune problems right now. And Hashimoto's thyroiditis is the most common autoimmune condition in this country. Environmental toxins, leaky gut syndrome, these are common triggers to autoimmunity. From this standpoint, how we would manage this is we would do proper testing, and we would identify, do you have any of these things? Do you have a food sensitivity? Do you have a gut infection? How is your blood sugar? Is it too high? Is it too low? Is it going up at the wrong times? How's your estrogen and progesterone balance? Is really bad in your body. We would look to see your levels of vitamin D and other essential things for proper functioning immune system, like glutathione, alpha-lipoic acid, or essential fatty acids. We would remove the stimulants to the dominant half of your immune system. We talked about that Th1, Th2. Certain supplements actually will stimulate one half, and certain supplements will stimulate the other half. We will want to make sure you weren't taking a supplement that acts as a stimulant to the part of your immune system that is already acting up. For example, if you're Th1 dominant and you're autoimmune, if you have an autoimmune condition, you're Th1 dominant, things like echinacea will stimulate even more and make you feel worse. So we have to be careful with that. And we have to check for that. All right? You have to have a doctor who's going to be able to look at those things. And the only way to know that is proper testing. Folks, we can't guess at this. We have to identify the exact causes. This is the beauty of what we do. We test people. There's no guesswork. Now, a lot of patients come to me and they've been on the internet and they've been trying to figure themselves out and they're guessing. Now, I don't blame them for that, because if I was sick and feeling awful all the time, I'd be doing my research as well. But what you need is someone to take you by the hand, show you. Now, this is exactly what's going on in your body, because what is going on in your body is going to be different than the next person, and theirs is going to be different than the next. So everybody's a little bit different, and there's no cookie cutter approach that's going to fix everyone. So the individual testing has to be done to identify the underlying culprits. Now, we spent some time talking about the #1 cause of underactive thyroid, Hashimoto's. Now we're going to talk about the 6 major patterns that we see when we are looking at an actual thyroid condition, something wrong with the thyroid itself or thyroid hormone. I'm going to go through these quickly. So #1 is primary hypothyroidism. This is where the actual thyroid gland itself gets lazy. We'll see this in conditions where we have heavy metal toxicity, or someone is exposed to a lot of toxins from the environment or their diet. The thyroid and parathyroid gland tend to be very sensitive to heavy metals and things like that. So we have to check for that. And this is a pattern that we see occasionally. So #2 is hypothyroidism that is secondary. It's secondary to a pituitary gland dysfunction. Remember, the pituitary gland is in your brain, and that is the gland that is the air traffic controller or the quarterback of not only your thyroid hormones, but a lot of other hormones. And it is the one that puts out TSH. The pituitary gland puts out TSH. I see this pattern a lot where the pituitary gland really starts to slow down. And there are certain things that will make the pituitary gland get lazy. Things like stress, like high cortisol. Cortisol is a stress hormone and it will shut down your pituitary gland. And now you won't be able to make as much TSH, and so you're not stimulating the thyroid gland, and so your production of thyroid hormone goes down. And doctors often miss this because TSH looks low, so they assume that your thyroid gland is doing well. High estrogens will do this, ladies. Folks, if we live in a sea of estrogen out there, there are so many chemicals in our environment, pesticides, plastics, petrochemicals, even times when you're smelling gasoline, that can convert into estrogen in your body. Estrogen doesn't start dropping in women until they hit menopause, whereas progesterone starts to drop when you're in your early 30s. So that by the time you hit menopause, progesterone is way down and your estrogens can still be elevated, or even normal if progesterone and estrogen are off balance. And you need 40 times more progesterone than you need estrogen to maintain good balance. So estrogen is balanced by progesterone, and you need to keep estrogen in check. Most of the women we see in our clinic really are estrogen dominant, and that can cause a problem with thyroid function. So fluctuating levels of glucose or insulin in the body can also cause the pituitary gland to get lazy, as will chronic infections. So we have to identify if this pattern is happening with someone. Now, this pattern is number 3, and this is thyroid underconversion. Now, I know we already talked about this, but this is missed. So the gland is making enough T4, or you're taking plenty of T4 in the form of synthroid or levothyroxine, but then it doesn't get converted from T4 to T3. And there's a very important enzyme that does that, and it's called 5-deiodinase. That enzyme is very sensitive to inflammation. So if you're inflamed, then that conversion from T4 to T3 will not occur, folks. Also, again, high estrogens will do that. High cortisol levels will do that. Lack of selenium and certain minerals will also do this. This conversion occurs mainly in the liver, like we talked about, and if your liver is sluggish for whatever reason, then this conversion cannot take place. Also, if your liver is sluggish, then we're going to have a hard time metabolizing other hormones to begin with, all hormones. So this is a very common pattern that we see, and it's missed because your doctor and most doctors rarely check for T3, which is the active form of thyroid hormone when running blood work. So number 4 is overconversion, where your body is making too much T3. And I know you're thinking, that sounds like that might be a good thing. And well, no, it's not. It doesn't work that way. When you have a high level of hormone, you don't want hormones getting too high or too low. When hormones are too high, here's what happens, okay? Your cells stop listening to it. It's like if you work for someone and your boss has just screamed at you all the time, and you've been working for him for years and all he does is yell, and you can't quit. So after a while, you just tune him out. Or if you're in a bad marriage and your spouse is yelling at you all the time and you can't get divorced, you just stop listening. So your cells do the same thing to high hormone levels after a while. We see people that are put on T3 hormone and it jacks that hormone really up high, and their cells stop listening to it, so it works for a little while and then stops working. This is also what happens in type 2 diabetes. You don't have too little insulin, you have too much insulin, and it's screaming at the cells, and the cells get desensitized. So when you make too much T3, your cells will start tuning it out. And I see this often in women, and the number 1 cause is too much testosterone. And most women who have bad blood sugar swings will be converting their estrogen into testosterone. And we do see this a lot, especially in younger patients. They'll have acne, or they'll have facial hair, or they'll be losing hair on their head. Their periods will be really heavy and irregular. And we see this most often in the younger female population, and they'll develop what is called polycystic ovarian syndrome, or PCOS, which is the number 1 cause of infertility in this country. So realize that most people who come to me have more than one pattern, by the way. So it's not just this third one or the second one. They can have Hashimoto's and this pattern, or they can have pattern number 1 and pattern number 4 as an example. So you've got to be able to identify which pattern or patterns that are going on with the individual. Now, I know that it seems like I get excited about this because it feels like we're detectives here, and when someone comes to see me, so we're going to figure this out. And so when we identify what's going on with them, and we go about handling them and managing them, and then the person gets their life back. And folks, there's nothing cooler than when someone's been suffering for many years and they get their life back. Number 5 is an elevated number of proteins, or the taxicabs that carry the hormone around in the bloodstream. Too many taxicabs, not enough free form of the hormone, and it prevents the hormone from getting into the cell. It's like the janitor that can't get out of his truck to unlock the door. This is also very common, again, with high estrogens. Ladies, you need to understand that if you are on the pill, or if you've been on the pill, you're more likely estrogen dominant. All right? The pill prevents you from ovulating. And when you don't ovulate, you don't produce what is called a corpus luteum. A corpus luteum is the follicle from your ovary once the egg is erupted from it. And this corpus luteum is your main source of progesterone in your body. And when you don't ovulate, you have lower levels of progesterone. Now I know the pill has some synthetic progestins in it, but you need that corpus luteum. It's your biggest source of progesterone in your body, and it's essential to keeping estrogen and progesterone balanced. A lot of you ladies are deficient in progesterone or are estrogen dominant, and this will cause an elevation in these binding globulins and will cause low thyroid expression. Has to be checked for. All right, number 6 is thyroid resistance. This is where everything looks normal, but the cells are not letting the thyroid hormone into the cell. Like the janitor, he all of a sudden has someone change the lock on the building so his key doesn't work and he can't get in. The number one thing that will cause this is high cortisol levels. Folks, cortisol, which is a stress hormone from your adrenal glands, is the arch enemy of your thyroid hormone expression. It will decrease your pituitary gland from producing TSH. It will decrease the inactive form of thyroid hormone T4 to get converted to T3, and it will prevent your thyroid hormone from getting into the cell. And this is a problem for a lot of you because we live in a stressful environment nowadays. And another thing that will prevent your thyroid hormone from getting into your cells is another marker some of you have never even heard of, called homocysteine. Homocysteine, when it's elevated, is like a bodyguard that will prevent the thyroid hormone from getting into the cell. And really, a lot of this is not being checked for. A lot of this is just not even looked for these days. So we have to identify this in the blood work and we get rid of them. Now, this one can be the most trickiest because it actually doesn't show up most often in the blood work. Another thing I want to cover, and I want to make sure I cover here, is because there's common questions that I get from patients. And it says, what if I have a goiter or thyroid nodules? Folks, a goiter and nodules are the result of improper thyroid function. They're not the problem in themselves. They're the result of an underlying problem. That problem could be any or several of these patterns which we just covered. Also, what if you've had your thyroid removed or you've had it ablated? Well, as you recall from earlier in this talk, we've already kind of covered this, but so many thyroid hormone processes happen away from the thyroid gland itself. You've still got to make sure that all those processes are working to their full ability. In fact, actually, even if you've had your thyroid removed, there's almost always some tissue remaining to work with, or that could be contributing to Hashimoto's or Graves' disease. So just because you've had your thyroid removed or ablated, or you've had, or you have goiters or nodules, there are things that can be done, and the answers are found in these patterns and the other things that we've already talked about. So when I look at someone who's come to me for a thyroid condition, they almost always have other things going on that's really minimizing that hormone, that thyroid hormone expression. So we've got to run tests, folks. Does your insurance pay for all these tests? Folks, no they don't. Should you care? No, you shouldn't. It's the only body you get. Insurance is a pharmaceutically based system. We've already talked about that. So stop thinking that way. You have to follow your insurance-based model. There's an old saying, the definition of insanity. What is it? Keep doing the same thing over and over and expect different results. If you're out there and you're watching this and you're sick and you're not enjoying your life, then look, your insurance card isn't going to fix you. You've got one trip around this thing called life, folks. One trip. I'm 43 years old. I've got a lot to live for. I enjoy my life, but I'm pretty healthy. You've got one trip around this thing we call life. And you have to ask yourself right now, is this the way I want to live the rest of my years? Tired, overweight, gut problems, can't think right, depressed, you have options. You have lots of options. This is the purpose of me taking the time to make this video. If your doctor is not finding out what's wrong and helping you, then go to someone like me or someone like me that can figure it out and get on with your life and get your life back. You know, I had a patient come to see me a little over a year ago, and traditional medicine had failed her for 12 years. 12 years. She moved into the area, came to her office, and she told me that when she woke up in the morning, she would plan her entire day around when she might be able to take naps. She was missing out on her kids' lives. She had more than one. She was missing out on her marriage. And it occurred to me that it can feel like a trap to have your health go so far south. It can feel like there's no way out. It can feel like you're in prison. And I felt so much compassion for her and her situation. Folks, let me tell you, if your body's not working like it should, then you need to do something different. You need to find out why, and if your doctor is not finding out why, then that is what we do here. So, if what I've gone over makes sense to you, I'm going to show you what to do, the next step you need to take to get your life back. But you've got to do the testing to figure yourself out and know why you're feeling the way you do. Don't cut yourself short on the testing. You don't want any guesswork here. You know, an interesting fact here. They did a survey and a study, and they found that the average doctor, including chiropractors actually, was 13 years behind on current medical literature. Folks, I'm not one of those people. I'm a geek. I'm always studying stuff. Sometimes it drives my wife a little crazy, but I'm always studying, and the stuff I'm sharing with you is not my philosophy. These are facts. It's in the scientific literature. But most of your doctors don't know it because they're 13 years behind. They're busy running a practice, and they have to see so many patients in order to keep their doors open and pay their staff, plus add in family time. So there's so much out there to know about, and that's the reason why I'm making this video, and I can't even cover it all. But you've got to act on it. So we do the testing to find out, do you have food sensitivities? Do you have a parasite? Folks, I can't begin to tell you how many underactive thyroid patients I've treated and overactive thyroid that have had parasites in their gut, or they've had unstable blood sugar, and again, food sensitivities. And once you clear those up, it's like a light bulb going off, and they start feeling better, and they start losing weight, and they start getting their energy back. And these are things not being checked for typically. And if you think about it, why would your doctor check for those if in his system or her system, if it's pharmaceutically driven? Would he check for those things? No. There's no pharmaceutical company that has a vested interest in finding a solution for your problem that isn't pharmaceutical in nature. I'm not a conspiracy theorist kind of guy, but that's just the way it is. So, all right. Now, we know that there's a high correlation between Hashimoto's autoimmune condition and gluten sensitivities. Gluten is a protein found in wheat, barley, and rye, and its molecular structure is very similar to that enzyme found in your thyroid gland that your immune system could be attacking. And we also know that if your immune system is attacking your thyroid, it could be attacking other areas of your body. So, like your pancreas or the nerves or the cerebellum or any other tissues in your body. So what makes our office different than any other doctor that you've seen? Well, the bottom line is we're not going to leave any stone unturned. We're going to find out why you feel the way that you do. Now we do that through proper lab testing and finding out a little bit more clearly how this is affecting your nervous system. Now with functional medicine and based on your lab findings, yes, based on your lab findings, no guesswork. You know, I have patients come in all the time and they're carrying bags of supplements, and they're taking iodine and tyrosine and selenium, and for some people those are great, and I'm not saying those are all bad, but with proper testing, without proper testing, I don't know if those are right for that person. I mean, they've got rotator cuff problems just carrying around supplements all day. That's not a way to live either. It's ridiculous. And I don't blame them. But through the proper lab testing, we're able to identify exactly what someone needs so that it will work and so that you'll get better. So we view the labs, and then we support those areas of the body. Now, we also have to look at you neurologically, because you need to understand that your brain is affected by all this. Metabolic problems cause neurological problems because 30% of your energy goes to your brain and nervous system. Now, there are 4 categories of neurological problems that you're going to develop that you may not even think are related to your metabolism or thyroid conditions. Abnormal sensations like numbness or tingling, or cold hands or cold feet, or pain. Abnormal movements. This is like spasm or weakness, or if you turn your head and your eyes and your ocular reflexes are off, so you get blurred vision or vertigo, or cause you chronic neck and back problems, or your gut isn't moving right and causing you constipation or diarrhea, so irritable bowel syndrome. And we have abnormal cognition or thinking, depression, anxiety, mood swings, inability to focus, memory loss. All of these things change because the brain requires so much energy, and your thyroid metabolism is such an important player in energy production in your metabolism. Abnormal posture. A large percentage of our brain is dedicated to keeping us upright against gravity. Our anti-gravity muscles along our spine, our extensor muscles, are keeping us upright against gravity, and our brain is constantly telling our muscles to do that. So we'll see postural changes, more of a flexion posture, and I'm exaggerating it. So they get neck problems, or back problems, or their hip problems, and their knees are trying to compensate. This is all very common. Folks, 70% of your brain is a brake pedal. 70% of your brain is trying to stop things from happening. Okay, so weakness in one area of your brain can cause increased firing in other areas. And the 2 areas that your brain needs to try to stop the most, or put the brake pedal on the most, are applied to the sympathetic, the fight or flight nervous system, and your limbic system, which is your emotional response to things. So people that have weakness in the brain, this can be due to poor metabolic function. And these are 2 areas that tend to escape, or the brake pedal tends to come off. So there are some symptoms of sympathetic escape. Headaches, sensitivity to light and sound, hormone imbalances, high blood pressure, poor digestion. And when you're in fight or flight mode, your digestion comes to a screeching halt. So you get cold hands, cold feet, frequent urination, poor sleep, chronic pain. These are symptoms of sympathetic escape. You would never think these could be due to an underlying thyroid condition, but they are. So symptoms of limbic escape, or emotional escape, lack of brake pedal in that part of your brain. You're irritable, you have mood swings, you have axing the husband's head syndrome, or lack of focus, anxiety, obsessive compulsive behavior, like thinking, oh gosh, what if I have this, or what if I have this, and you can't quiet your brain. Depression, mood swings, these are all limbic escape signs. The most active area of your brain is called the cerebellum. All right, it sits in the back of the brain, right back here, and it controls all of our spinal tone and all of our eye movements. So you'll see neck and back pain, clumsiness, balance issues, because it's supposed to smooth our movement and make our movement accurate. It coordinates thought. We'll see visual disturbances like blurred vision and that vertigo. You're in a car, you get sick, or you're looking at a pattern in the carpet and it throws you off, makes you nauseous. So these are some of the things we see neurologically. So what can be done? Folks, you could do brain-based therapies. The brain is just like a muscle. If I had a cast on my arm, the muscle in my arm is going to get weak through disuse. Your brain is just like that. If I took the cast off and started exercising the muscle and ate right and fed it, it would get the muscle back. Well, your brain is the same way. It's called neuroplasticity. Your brain can improve at any age, and we see this all the time. You don't have to suffer with the depression, the memory issues, the brain fog. So how does this happen to the brain? Well, thyroid problems, chemical stresses, physical stresses, emotional stresses, they cause the brain to fatigue. Chemical and physical stressors would be like anemias, blood sugar imbalance, food sensitivities, autoimmune problems or immune system problems, poor diet, high inflammatory diet like we talked about, hypothyroidism, prescription and non-prescription drugs, chronic inflammation, hidden infections in the gut. These are metabolic problems that create problems in the brain and nervous system that we then identify. So what can be done? Folks, well, just like with a muscle, If you give it what it needs, activation and fuel gets stronger. So your brain's the same way. So we could do specific neurological exercise to rehab the areas of the brain that are weak, and then make sure glucose levels and inflammatory levels, hormone levels, neurotransmitter levels are all proper. So no anemias, so you have proper oxygen functioning, and your brain starts to function better. So through functional neurology, we're going to do things like balance exercises, postural exercises, visual tracking, light stimulation, olfactory stimulation, timing and rhythm exercises. All these are different things that can activate parts of your brain so you get your brain function back. These brain activation techniques, and most of these, you can do them at home. So you have a metabolic problem when you have an underactive thyroid. You have a metabolic breakdown with neurological complications. There are multiple pieces to this puzzle, and you have to identify all of them and get them all together to get your health back.
Hi, Older Me back again. Now, what's next? Please understand this. Knowing something and not doing anything about it is just like not knowing it. You need to take action. My team cannot help you unless you call us and make an appointment, okay? So we schedule you for 2 visits, and here's what we do on your first 2 visits. When you call and schedule an appointment, tell them that you saw this video in its entirety. We will not see anybody until they've watched this video or have seen us give a class on this information, because we don't have time to explain all this in our office. We're very busy, and someone cannot just come in and say, hey, I understand your office manages these type of problems. That won't work. They gotta know what we do. We don't have the time to explain all this data one-on-one. That's why I make these videos. We're going to have you bring in any recent labs, okay? Bring in any recent labs. You don't have to run all over town getting them, but if they're easily accessible, bring them in. They can be helpful. When you call the office to make an appointment, they're going to mail or email you some very important paperwork for you to fill out prior to your first appointment. Fill it out before your first appointment. And at your first visit, we want you to bring your spouse or significant other. We need them to understand what is going on. You got to understand, if you're watching this alone without your spouse or significant other, this is affecting them. And you need to realize that they need to see that there are options out there for you. So on visit number 2, so this is visit number 1, this is visit number 2, we're going to let you know if we can accept your case. Now, what do I mean by that? Some people come to us and they're like, I don't want to make any lifestyle changes. I'm not going to make any changes. Just fix me. Well, I want you to know that's okay, but don't come see us if you have that attitude, all right? You'll waste your time and your money and our time, all right? And you have to have an attitude like, you know what, I'm sick and tired of being sick and tired, and I want answers, and I'm not getting any answers, and what you say makes sense. So if this doesn't make sense, if what we've gone over doesn't make sense to you, that is totally fine. But respectfully, we're likely not the right place for you. Honestly, this has to make sense to you. Otherwise, it's not going to be worth it. So on visit number 2, we're going to go over any and all further testing you'll need to do. So we're going to review everything that we found in visit number 1, go over any further testing that will need to be done. We talked about all the testing that someone might need. We're going to review what we think you're going to need. And we're going to overview your treatment plan. Most of our metabolic patients are managed in our office for 6 to 12 months. Usually after that time period, you don't need us anymore. We'll have it figured out and we'll teach you. This is a teaching program. When you come see us, you're going to be taught. We're going to identify the underlying causes, and we're going to teach you how to manage that for the rest of your life. There's an old saying, you can give a person a fish and feed him for a day, or you can teach him how to fish and he'll feed himself for a lifetime. Nothing pleases our team more than to run into a patient we haven't seen for years out and about, and we hug and kiss and cry or whatever, we high five, and they tell us how good they're doing, how good they feel, how their life is better, or better yet, their kids tell us mommy or daddy is better. That makes everything that we do worthwhile. The stuff that we do is not easy. It's taken our team thousands of hours of postgraduate studies and hours in independent study to learn all of this. And this is the benefit you're getting when you come to see an office like ours. We're going to overview your treatment plan. All right. How often do you need to see us? It varies. If you have musculoskeletal problems, we might need to see you more frequently. But typically, For metabolic problems, a patient is going to come in to see us about twice a month. On the second visit, we're going to overview any financial obligations that you have. What is it going to cost you? And I'm going to give you a rough figure in a few minutes of that. On that visit, we want you to bring your spouse and significant other as well. Why do we want them on the second visit? Because we're going to go over what's wrong or what we found. We're going to go over what it's going to take to get you better and what it's going to cost. We like to be transparent, and you should come in already having a pretty good idea what it's going to cost, which I'll go over here shortly. So to recap, what you need for your first appointment. You need your paperwork filled out completely. Bring it in filled out. If you come in and we reserved an hour for you and you don't have the paperwork filled out, we may not have time to see you. We have a busy practice and we do everything we can to run on time, and you filling out the paperwork on our couch will eat into that time. You'll be happier if you use your couch at home to fill it out ahead of time. Again, on that first visit, we want you to bring your spouse or significant other and have them there. If your spouse is involved in any way, shape, or form in your health and your decisions, then we want him or her to be at this appointment with you. It just works that much better. All right? So here's the offer that I'm going to make to you. We only accept 10 new metabolic patients per month. That's all, 10 per month. We don't just jam up the schedule, leaving the provider team no time to see you and help you. That's no good. So we keep our patient load limited so we can give the best care possible. Right? The cost of these two visits that I just went over, these two here, the cost of those two visits is $550. If you make an appointment after watching this video, then that $550 is reduced to $170. And that does include the first visit's lab work, okay? So here are our rules. There's just some rules we have. We want to be very clear. You've got to be willing to make some serious life changes. Something's got to change. If you keep doing the same thing over and over and over, but expect different results, you're going to go insane, all right? And I know that's been happening to some of you. You just don't know what to do. That's what people hire us for. So when you do what we recommend, it'll work because it's not guesswork. It's going to be based on what we see in the lab work. So you've got to be willing to change some things in your life, folks. That's just the way it is. Please don't shoot the messenger. It's just a fact. You have to take accountability for your health. Can't blame your parents, can't blame your spouse, your kids, the president. It's you. And once we teach you, then it is up to you. Now, we do accept insurance in our office, but please understand this. Please understand this very clearly. Insurance does not cover all of this. It actually doesn't cover much of it all, if anything. And I mentioned why earlier in this video, if you recall, so I'm going to give you a rough guideline. If it's not worth $300 to $500 per month for 18 months, we could do an 18-month payment plan. If it's not worth $300 to $500 per month for 18 months, now you're not under care for 18 months. I mentioned that. We usually see patients for 6 to 12 months, but we can stretch out the payment plan. If it's not worth $300 to $500 per month to you, potentially interest-free for 18 months, then we might not be the place for you. I'm giving you a rough idea of what it costs. Now, some patients will pay it all up front and they get a discount. And we'll go over exactly what your care is going to cost on your second visit. And just so you know, you're under no obligation. You could do whatever makes sense for you, but it does have to make sense for you, okay? Now, you should ask yourself, all right, on a scale of 1 to 10, how serious is your illness? What you have is a chronic illness. They don't get better on their own. They only get worse. Nobody has a magic wand here, okay? They're going to change. It's going to get worse over time. So where do you see yourself in 1 to 3 years from now? You should look at that. Where do you see yourself from 1 to 3 years if nothing changes? Due to time constraints, we can only accept those that are truly committed. You'll be amazed at how healthy you can get once you go to someone who truly understands the underlying causes and addresses those causes. So I hope this makes sense. If you're watching this and you're ready to really make a change in your life, please call our office, make an appointment. Let's get started. We hope to see you soon.
Hi, I'm Lyric. I had to go for a checkup and they ran my blood and found out that I had a low thyroid or a slow active thyroid. And I didn't feel right about taking medication because I'm not a medicine person. So I found Dr. Morris and his wonderful staff at Magnolia Medical Center, and I decided to check it out and let them know what was going on. I didn't think I had any thyroid issues. I never had anything wrong. And then one day, I came in for my test, and there were a couple of things that could indicate that there was something wrong with my thyroid. So after extensive blood work and a lot of education, I went on the 6-week repair and rebuild program, and that saved my life. It changed my life. I look at food very differently because what happened was I was able to see what food was causing inflammation in my body. For me, it was anything with gluten and mainly eggs. So after this 6-week program, he helped me get all of my organs back to working and running perfectly, so that now if I do eat something that has gluten, it will leave the body. It won't cause such bad inflammation. But now I eat very differently because of that. So coming here, I didn't have to take medication. I didn't have to cover up my problem and create more issues. Come to find out, I didn't have a thyroid issue. I had my antibodies attacking my thyroid because the food that was going into my body causing inflammation and making me not feel well when I didn't even realize I didn't feel well because I was so used to it. That was where the problem was. So now, what's great for me is I make better choices with my eating. I've changed my lifestyle. I don't need to throw medication in my body and feel worse. If I would have taken that medication for my so-called slow thyroid, then I would have developed a thyroid problem, and that could have been really, really bad for me. I come here once a year or whenever I'm not feeling well just to make sure that I'm on the right track, and I couldn't imagine going anywhere else. The staff is great, they're very personable, and they will help you get on track to be healthier. So give it a shot and stick with it because your health's important.
Well, when I was 19, I came down with mono. Had been really healthy up until then, never had any symptoms of anything strange. I got mono and I kind of just never recovered. At that point, the doctors I was seeing at the time did a lot of testing. I went through about 2 years of testing and different pharmaceutical drugs and things that gave me horrible side effects, and I felt terrible taking them. I got really upset one day. I just knocked all the medicine off my shelf and said, I'm done. I'm done with doctors. I'm not doing this anymore. And it just kind of dealt with my symptoms. And after about 2 years of actually being in and out of the ER and the urgent care while I was in college, they finally just diagnosed me with fibromyalgia and chronic fatigue and IBS and basically sent me on my way. That was 13 years ago. And I've struggled with fatigue and body aches and pains and just being limited in my physical activity ever since. About halfway through that point, I got real desperate, went back to doctors who started offering anxiety medication for fibromyalgia, and that was all they would offer. So I declined and said, okay, go back to do my own thing where I just kind of stick this out and suffer through it. I saw some chiropractors along the way who helped me with some issues I had with neck pain and some nerve pain, but never saw big changes. I would just kind of go in for maintenance. So I came in and found out that my vitamin D was extremely low. So I got on a good dose of vitamin D. I started taking some really great supplements that just started bringing my energy back. I started being able to get out of bed. Started feeling really good after just about a month or two. But the great thing was that the doctors continued to dig. Even though I was getting better, just kept looking for, well, let's see if there's anything else in there. And we found out that I have a genetic mutation that was actually causing a lot of my symptoms also. And so now I'm on a supplement for that, and that's helped so much. I'm able to go to the gym. I started working with a personal trainer, just doing things that I never ever thought that I would be able to do, 6 months ago when I could barely get out of bed and barely take care of my toddler. This has definitely changed my life. My friends and family tease me and say I'm pretty much a walking billboard for Magnolia Medical Center anyways, because I'm always telling everybody with their children or with anything, I'm like, will you please just go there first before you go to your regular doctor, just see what they have to say, get a consultation. Because I've been on a 13-year journey and I've tried everything. I've changed my diet. I've just done everything I could find, everything I could read on, every program where I am. I've gone Western medicine, I've gone holistic, and I really didn't get real results until I came here.
My name is Missy, and I was diagnosed with a thyroid disorder over 15 years ago. My medical doctor would do the TSH test. The thyroid-stimulating hormone was the test that determined how much medicine I took. I was on Synthroid, I was on levothyroxine. I tried to explain to my doctor that I was irritable, I had no energy, and it was really affecting my life. And she expressed that that was classic symptoms of depression, so we moved forward with an antidepressant. For the sake of my family, I decided to take that route. After a month, I went back and told her it just wasn't really working. I mean, honestly, it helped with my mood a little bit. So I told her that, I was still tired. So she decided to do another antidepressant to mood stabilize. I did that for 10 years with 2 antidepressants and continually going up and down with my thyroid medicine. So when I came to Magnolia Medical Center and explained my symptoms, they didn't want to treat the symptom. They didn't want to medicate the symptom. They expressed the desire to get to the bottom of it. So instead of doing just a TSH lab, they drew 8+ labs on my thyroid. That gave a really good picture of what my thyroid problem was. And it turns out it wasn't a thyroid problem. I had an autoimmune disorder, and my immune system was attacking my thyroid. So the thyroid couldn't do its job. So we decided to find out which antibody was the problem. So I did a challenge, and the very first supplement I tried worked so quickly. I was shocked at how quickly it was working, and moved forward with that supplement on a regular basis. I changed my diet. I had to change my diet. There were certain foods that everybody would consider good for you foods that were not good for me. They boosted the wrong antibodies, and that was causing the problem. My family noticed the changes, that my mood was different. I wasn't sleeping all weekend. I would wake up completely rested on my own without an alarm, and stayed up well past the kids' bedtime, and was able to enjoy the day. My mood was completely different. My family was just thrilled. After 6 months, my thyroid antibodies had gone down by more than half, and now after a year of treatment, the thyroid antibodies aren't even an issue. They don't even show up on the lab anymore. So once I was able to get the immune system in order, my thyroid is now able to do its job. I don't take antidepressants anymore. I don't even take thyroid medicine anymore. I don't need it. I do continue with the diet. I do continue with my supplements, but it has made all the difference in the world. I'm so grateful for a place that paid attention to the symptoms and looked for the underlying cause. Not just medicating the symptom to make the symptom go away. Now my condition, the underlying cause is handled and it's gone away. And I'm so grateful to not be on any medications. And the lab work continues to show that I'm in a better place. So I'm grateful.